Seth, we're going to bring him in now. We're going to talk about, let me see what this is. Andropause and hypogonadism. Did I get that right? Yeah, sorry for the delay, but I had a little thing there with St. George's College, but I'm old school. So let's see what we're talking about here this morning, Seth.
Alright, so andropause, and they also call it hypogonadism.
Right.
Right, hypogonadism. There are other terms that they call it, like late onset male menopause. Alright, so they have different terms that that they use to call it. Some of the terms might be declining male aging, declining aging male, all right, and you have aging male syndrome, and of course late onset of hypogonadism. So it's all about like the male menopause. They say that every year after the age of 20, you have a decline of about 1% in your testosterone levels, all right? But it's not so much about your testosterone levels, but about free testosterone. And that has to do with increased production of something called sex hormone binding globulin. All right. Now, in women, as you would have seen in the past, I would have mentioned issues that women would have suffered with that would have been as a result of an underproduction of sex hormone binding globulin, like things that facial hairs and PCOS and stuff like that. When they have an underproduction of that, so it leaves the androgens unbinded and therefore free to move around and attach to cells and increase the woman's testosterone levels, which can become problematic for her. But it has to have a balance with it. So in men now, if you have too much sex hormone binding globulin being produced, then you have too much binded testosterone, and therefore you don't have enough free testosterone to go into cells and activate the cells as they should. All right. So let me share my screen here and show some of the symptoms of this condition that a lot of people are suffering from. And what I'm also going to show you is when you see it, you're going to see a relationship between that and nutritional deficiencies.
Okay.
All right. Now, the word andropause comes from two words, andros, meaning man, from the Greek word, and pause, meaning a cessation or a stop. All right, so that's when a male's, his sex hormone is reducing. All right, and you see things like examples: no energy, depression and sadness, insomnia, difficulty sleeping, erectile dysfunction, lowered self-confidence, difficulty concentration, decreased motivation, reduced libido, increased body fat, reduced muscle mass and feelings of weakness, gynecomastia, or development of breast and infertility. So these are issues that would affect a male that is suffering from or going into these phases of andropause. But all these issues are also issues that you get from nutritional deficiencies or when you consume a lot of toxic foods.
Okay.
So is it that this is a natural decrease in male testosterone levels as one age, or is it due to nutritional deficiencies?
Right.
Now, the mere fact that all men aren't affected the same indicates to me that what we call andropause, just like with menopause and endometriosis and adenomyosis and PCOS and all these other fertility issues that women suffer with, including fibroids, these are issues of environmental factors, the main one being what we consume.
Right.
And many people today do not understand that what you put into your mouth on a daily basis, what you consume as food on a daily basis, have a bigger impact on your health than anything else in existence, right? We would blame stuff on genetics, we would blame stuff on the air, we would blame stuff on toxic fumes, when the effect that those, not saying those things don't have an effect, they have an effect on us, but the expanse or the percentage of the effect that they have on us in comparison to the effect that what we eat on a daily basis, what we put into ourselves willingly on a daily basis, percentage-wise, those other environmental factors are under 0.01%. Right?
Okay.
What we consume and put into our bodies affect our health in a major way, and most people are unaware of it. And that is what I show people in my consultations and re-education session. I get them to understand that what you put into your body on a daily basis plays the most and biggest important or the biggest role with regards to your health. Now, we look at the data, and the data says that, you know, after the age of 20, you have a drop in testosterone levels, free testosterone levels, of about 1% per year.
Right.
Keep in mind that that is so-called normative data, and you have to understand what they class as normative data is that they look at what is common in society at present.
Right.
That does not mean that is what it should be. It just means that is what is common in society. For example, what is proper vision? Normal vision is what?
2020.
What do you call it?
2020.
2020. My vision is 2015. What does that mean? It means from 20 feet away, I could see what the average person could only see from 15 feet away. So my vision is much better than the average person own. Right. Is my vision anything special? No, it's how I am supposed to see. But that could be classed as not normal, because normal vision is from 20 feet away. You could only see things that everybody else could see from 20 feet away.
Right.
Right? So my vision is better than the average person own, but that does not make me abnormal. Normal vision should be 2015, not 2020.
Okay.
Right? But because so much of people don't have proper sight, we normalize 2020.
Right.
So the same way, because a lot of people are reducing their free testosterone level at 1% per year among the men, we then say, that is normal. That is not normal. That is not normal. Right? It's common.
Yeah.
And we need to stop normalizing things that are common. But they aren't natural. Right? So it's common, but it's not natural, and therefore it should never be taken as normal. So when somebody tell you, you are healthy for your age, I don't understand what that means. Right?
Yeah. Particularly to elderly people, where you look healthy for your age, you know what I mean? Yeah.
You're healthy for your age? I don't understand that. That gives people a false sense of security. And therefore, they believe that I could continue doing what I have been accustomed to doing, right? Because I am healthy for my age.
Yeah.
You could barely walk. You have all sorts of illnesses. You're hypertensive, you're diabetic, you're obese, all these issues. But you're healthy for your age. That makes absolutely zero sense in my book. All right? So what I tell people, if you want to make a change in your life for the better, if you want to feel young and be young for a long period of time, because I have mentioned before that the average Trinidadian live up to 4.9 years, and when we're supposed to be hitting 150, people think I'll be joking with that. No, that's true. We only live in half our lifetime. So when we're thinking that we are old at 75, right, and crooksing out at 75, we're not supposed to be. You're supposed to be middle-aged then, right? Middle-aged and still youthful, but we aren't. It's because we are consuming things that are harmful to us, and we are oblivious as to these things that are harmful because we aren't educated properly. They don't teach us proper nutrition in schools, right? And there is a reason for that. Many people even taking medication, and what I've noticed from a lot of people that have been coming to me and doing their consultation, many people take medication and they don't know what the medication is. They just blindly trust, take this, and they go and they take it. They go and they take it. I know people taking medication, have been taking medication for over a decade. And in clinical trials, those medication after 2 years in healthy people caused liver disease.
Yeah, that's a fact. There, people will go on and take a medication, and you will look on the label to see what's in it, and 95% of the things that you're going to see on that label, you have absolutely no idea what it is, but you're going to take it.
Most people can't pronounce it, and they go in and take it. And when you check, and then you might see things that say, oh, it's natural compounds. Yes, petroleum is a natural compound too. Right? Acetaminophen is from phenols, right? But it's an over 600 over-the-counter drugs. It's the #2 cause for liver transplant. People know that. Right? But they take those drugs on a daily basis. And then we think the side effects of those things and of our poor nutrition, we say, oh, that's normal for your age. It's not normal, people. It is not normal. So what I offer people is the opportunity to educate themselves. That's what my programs is about. You know, I don't put you on any drugs or any products, so don't call and ask me what I have for this or I have for that. Yeah. I have lifestyle changes. That's what I offer. Knowledge and lifestyle changes. That is what going and fix and reverse your diseases. Ask everybody that have gotten their diseases reversed. Knowledge and lifestyle changes.
And lifestyle changes. Seth, I want to thank you. I went over the time a little bit, but understandably so. I want to thank you for joining us. I had a call you, I had to ask you something. Yeah, boy.
No problem.
Yeah, I will call you. I will call you after. I will call you this morning, during the morning period. It's going to be an interesting one. I want to hear what you had to say on that one. But nevertheless,
no problem.
Yeah, thanks a lot for joining us, man. And people, you could call.
Thanks for having me.
You can get your book your appointment, get educated. 761-1952 or 279-3935. All right, Seth Weil aboard. Nice.